Hello and welcome to this mental health report. This mental health report is brought to you by the Pan American Health Organization and the government of the Virgin Islands. I'm your host, Director of Light Communications, Natasha Letzum. Today on the program, we have with us Lina Verdeli, Dr. Lina Verdeli, here to talk about MH gap. Welcome to the program, Dr. Verdeli.
Thank you very much. I'm honored to be here and talk to people from my beloved British Virgin Islands. I had a wonderful and memorable training experience.
Well, we're happy to
So
hear that. I know we want we want to know all about that training. So can you tell us a little bit
yes,
about the MH training and its role in
yes,
responding to humanitarian disasters?
yes. You know, a very important concept in the MH gap is this word gap between those who need mental health care and support and those who end up getting it. And in low resource areas around the world, this gap is huge. So the World Health Organization, and in this case, PAHO, the Pan American Health Organization branch of the World Health Organization, um, organized this training in the clinical guide called MHGAP, Mental Health Gap Action Program, which is a clinical guide to address and bridge this gap and is for persons who are not mental health specialists, who are not psychiatrists, psychologists, but work in other settings, such as primary care settings. So the humanitarian guide is for those who work in humanitarian settings, and it's a guide about recognizing and addressing and managing, emotional reactions following humanitarian emergencies. So this is the guide that we use to do the training.
Uh-huh. So from your training now, what are some of the highlights and how were persons affected by the training? What was some of the feedback?
Yeah, yeah. So I did the training actually 2 years ago with Dr. Claudina Gaetano, my colleague from the PAHO, and it was a 4-day training. So let me tell you some of the highlights of this. First of all, once I started, from the moment we landed on the island, and from the discussions with a taxi driver, I realized he was telling me about how affected people were from Hurricane Irma 2 years back at that point, 4 years now. Still, after 2 years, people were affected, their livelihoods, their relationships, their health, mental and physical health. He said, we didn't lose a lot of people, 4 or 5 people during, the actual disaster, but afterwards, many people died of heart attacks. Many people suffered. So when people's, mind suffers, body suffers, of course. And the other big highlight is the first day when we started the training with Dr. Cayetano. When we expected 25 people, 41 people showed up. 41 people showed up,
Wow. Wow.
twice as many people as we really expected. So I thought that before I even started the training, I had the sense of not just of the need, but the demand for the training. So that was important, to me. Over there, our attendees were some specialists, mental health specialists. We had a psychiatrist, some psychologists, social workers, but also non-specialists. We had people from attendants, in nursing homes, wonderful clergy, uh, counselors in schools, excellent colleagues, counselors in schools. So I was very taken by how motivated were people to help each other and themselves. So the training that we did with Dr. Cayetano was really very immersive. In other words, very experiential. We used people's experience. We built on people's experience. It was very active. They participated. And I remember, what struck me was the need that people had to talk about their story and their experience and their pain. It was evident. There were tears at some point because, we covered areas like grief, depression, post-traumatic stress disorder, use of alcohol and drugs, following disaster, the different ways that human pain is manifested.
And if,
So, yes.
sorry, if you can recall, who was that training targeted to? Because I know that, there is a big stigma surrounding, mental health access and accessing services that persons might need. What are your thoughts on that? And do you think that that was an issue, or do you think that that is an issue for most people, even where you live and around the world, is accessing mental health care, something seen as bad?
Stigma is an issue, but when double the number of people that you expect in a training show up, that tells you something. And what we know now very well is even more important than stigma is lack of access, lack of availability of services. That's a big problem. So if people know that there are services, there are trainings, there are support systems, stigma, plays a much secondary role. So I am very aware, and Paco is very aware, that people don't learn just by these trainings, right? You need support, you need supervision, you need integration with the systems of care. So this is the next challenge now.
Hmm. Now, as you know, the mental health and psychosocial support project is, their basis is to build resilience.
Yes.
Any extra occurrence or any future occurrence of any disaster, we want to know that the people of this territory can manage it and manage it well. So, from your perspective, how can the BVI utilize this MH gap training and its efforts to be even more resilient?
So that's a good question, given climate change and what, how the world is going to be affected, right? It's very important to keep that in mind. You have wonderful, mental health professionals there, like Dr. Samuel, who is, also very involved in climate change, work, resilience, and mental health. She's a psychiatrist. So, um, these workshops are important, but there has to be a follow up. There has to be more funding for supervision and for programs. So now that the world is recovering little by little from the pandemic, I think the next step is to take it to the next level and and provide support for the integration of these principles of care within the system of care. Primary care clinics, also train people who are gatekeepers, the clergy, the home attendants, school counselors, in doing some basic, case, identification, find who is suffering, who is struggling, do two, three things to support, to give a upbeat, realistic, very supportive, guidance. And then if the person is still struggling, refer to those, to appropriate persons. But before, what we is really very important to keep in mind is became very well me how strong the ties are in your communities there, right? So it's about really making sure that the ties are strengthened, that people offer this care within the community first before they send it to, the experts, or send to the experts only the severe cases. But a lot can be handled in the community with some guidance and some support.
Mhm. Now, Dr. Verdeli, before we close the program, can you leave us with any tips, any type of things that we should be aware of, just in case we need to intervene on the behalf of anybody? Strengthen us with a bit of your knowledge as we try to wrap up the program.
Some key ingredients of building resilience is they are, despite cultural differences, they are very similar among human beings. And they have to do with, breaking the social isolation, of helping each other feel some safety, emotional safety, um, helping the person have a sense of options, not feel trapped, right? Problem solve, find options. When the person is also part of, options is when the person is helpless and hopeless, to assist, in finding advocates. When the person doesn't have a lot of power, help them find advocates, people who have perhaps more power in the system to advocate for them. These are some of the things that come to mind.
Wow, thank you so much, Dr. Vidali. Once
Mhm.
again, you've been listening and viewing the Mental Health Report, and this report is being brought to you by the Pan American Health Organization and the government of the Virgin Islands. Today, we had on the program Dr. Lina Verdeli here to talk about image gaps. Dr. Verdeli, would you mind signing off?
It's I'm very honored to be part of this. Thank you so much, and I hope to see you in person soon.
Very soon. Thank you once again, Dr. Vidali, for sharing with us and for giving us a moment of your time. We appreciate it.
Take care.
And once again, you're reporting for Light Communications. I'm the director, Natasha Letson. Thank you so much for tuning in. And once again, this has been your mental health report, and it's part of the Mental Health and Psychosocial Support Project sponsored by the Pan American Health Organization and the government of the Virgin Islands. Thanks again for tuning in.